when parenting feels heavy all the time. Parenting is often described as joyful, meaningful, and transformative. All of that can be true. But for parents who live with depression, anxiety, trauma, OCD, chronic stress, or other mental health struggles, parenting can also feel relentlessly heavy. Not just on hard days, all the time. The weight does not lift when the house is quiet. It does not disappear after a good moment. It lingers in the body, in the mind, in the way even small tasks can feel overwhelming. This kind of heaviness is rarely talked about honestly. Many parents carry it in silence, believing something is wrong with them because parenting seems harder than it should. They hear messages about gratitude, perspective, and positivity, and instead of feeling helped, they feel more ashamed. If you are a parent who wakes up already exhausted, who loves your child deeply but feels emotionally depleted, you are not broken. You are responding to real strain with a nervous system that is already under pressure. For parents with mental health struggles, parenting is not just about meeting a child's needs. It is about doing so while managing intrusive thoughts, emotional dysregulation, panic, numbness, grief, or constant self-doubt. It is about trying to be calm when your own body feels unsafe. It is about giving patience when you feel like you are running on fumes. That is not a personal failure. That is a heavy load. One reason parenting can feel so heavy is that it is relentless. There are no true days off. Even when children sleep, the mental labor continues. Planning, worrying, remembering, anticipating. For someone already dealing with depression or anxiety, this constant demand can drain what little emotional energy is available. Tasks that might seem small to others, like getting everyone dressed or making dinner, can feel monumental when motivation is low and the mind is loud. Mental health struggles also distort how parents experience themselves. Depression can convince you that you are failing, even when you are doing your best. Anxiety can make every decision feel dangerous, every mistake catastrophic. Trauma can cause ordinary parenting moments to trigger fear, shutdown, or anger that feels out of proportion and deeply confusing. OCD can flood the mind with unwanted thoughts that create shame and terror, even when behavior is loving and careful. These internal battles are invisible, which makes the heaviness even lonelier. Another layer of weight comes from expectations. Society often expects parents to be endlessly patient, emotionally available, and grateful. There is little room for complexity. Parents with mental health challenges may feel they have to perform wellness for the sake of their children. They may hide their struggles, afraid that admitting how hard things feel will make them seem unfit or unloving. This pressure to appear okay adds another burden to an already heavy experience. Many parents in this situation feel guilt constantly. Guilt for being tired, guilt for needing breaks, guilt for not enjoying every moment, guilt for snapping, withdrawing, or crying in private. But guilt does not mean you're doing something wrong. It means you care. The problem is not that you feel guilt. The problem is that you have been taught to interpret your exhaustion as a moral failure instead of a sign that you need support. It is important to say this clearly. Loving your child does not require enjoying parenting all the time. You can be deeply committed, protective, and nurturing while also feeling overwhelmed, trapped, or numb. These experiences can coexist. The heaviness does not cancel the love. The love does not erase the heaviness. When parenting feels heavy all the time, it often helps to shift the goal. Instead of trying to be the best version of yourself, aim to be a safe enough version. Safe enough means your child's basic needs are met. They are fed, cared for, protected, and responded to with reasonable consistency. Safe enough means repair happens after rupture. It means you keep showing up, even imperfectly. This standard is far more realistic and far more humane. For parents with mental health struggles, self-compassion is not a luxury. It is a necessity. Without it, the internal dialogue becomes punishing. You may tell yourself that other parents manage better, that your child deserves more, that you are failing them. These thoughts feel convincing, but they are symptoms, not truths. Learning to speak to yourself with the same gentleness you offer your child can slowly lighten the load. This does not mean pretending things are easy. It means acknowledging difficulty without adding cruelty. Practical support matters too. Many parents feel they should be able to handle everything on their own. This belief keeps them isolated, If possible, reducing the burden through concrete help can make a real difference. This might mean therapy, medication, parenting support groups, or practical assistance like childcare, meal delivery, or simplified routines. None of these are signs of weakness. They are tools that help you conserve energy for what matters most. It is also important to recognize that children do not need perfect parents. They need attuned ones. A parent who struggles but is honest, repairing, and emotionally present when possible teaches powerful lessons. Your child can learn that feelings are manageable, that mistakes can be repaired, and that care does not require perfection. This modeling can be deeply protective, even if the path feels messy. On the hardest days, parenting may feel like survival. You may count hours instead of moments. You may do the bare minimum and collapse when the day is done. This is not a sign that you are failing. It is a sign that you are enduring. Survival mode is not a permanent state, but it is sometimes a necessary one. Allowing yourself to be in it without judgment can prevent additional harm. There is also grief in this experience. Grief for the parent you thought you would be. Grief for the ease you imagined. Grief for the energy you do not have. This grief deserves space. Ignoring it does not make it go away. Acknowledging it can be a step toward healing. You can grieve the difficulty while still loving your child fiercely. If parenting feels heavy all the time, it may help to remember that seasons change, even when it does not feel that way. Mental health is not static. Children grow, circumstances shift, support can increase. Relief may not come quickly, but it is not impossible. Holding on to the idea that things can be different does not require blind optimism. It requires gentle persistence. You are not alone in this experience, even if it feels isolating. Many parents are quietly carrying similar weight, afraid to speak it out loud. Naming the heaviness does not make you a bad parent. It makes you an honest one. And honesty is a foundation for real connection with yourself and with your child. If all you can do today is keep going, that is enough. If all you can offer is presence without joy, that still matters. Parenting while struggling with mental health is hard in ways that are rarely acknowledged. The fact that you are here, still caring, still trying, speaks volumes. The heaviness you feel is not evidence of failure. It is evidence of how much you are holding.